I'm worried about the patients who need the care now, and I'm also worried about patients who need abortion and miscarriage care in the future and will not be able to get the care they need because they will be seen by a doctor who's not trained to provide that care.
How the overturning of Roe v. Wade impacts abortion care training. Dr. Jody Steinauer leads the Kenneth J. Ryan Residency Training Program in Abortion and Family Planning at the University of California, San Francisco's Bixby Center for Global Reproductive Health. Abortion care is a crucial aspect of OB/GYN physician care. As states across the country impose more abortion bans, OB/GYN residents are at risk of being unable to provide adequate abortion care.
I felt very worried that we would not be able to make sure that our OB/GYN residents get training in abortion care and therefore would graduate without the skills they need to provide care for their patients in the future. We did a study recently where we found that 44% of all OB/GYN residents, that's more than 2,600 residents, are being trained in programs in states that either are currently banning abortion or are likely to ban abortion. So even if we have to train a quarter of those each year, because it's a 4-year residency program, that's more than 650 OB/GYN residents per year that are at risk of not being trained to provide the skills they need to provide.
Reduced access to abortion care training could severely limit the number of OB/GYNs patients can turn to for their reproductive health needs.
Being able to provide abortion care is so central to the OB/GYN identity that we're worried that fewer medical students will want to train in states with restrictions, and that residents who are trained in states with restrictions will want to leave after training. And many communities lack enough OB/GYNs to begin with. So we'll be seeing that these states with restrictions will not have enough obstetricians to provide prenatal care and labor and delivery care.
Healthcare providers are being forced to weigh their ethical obligations to patients against possible legal repercussions for providing abortion care.
I am hearing stories of hospital systems where the doctors are trying to do the right thing to save people's lives, and they're being either prohibited from doing that or delayed because of concerns about legal ramifications. And I'm very worried about this, about what could happen, both again for the patients that we're seeing today and the patients that our graduates will be seeing in the future. We need all of these leaders in nursing and medicine and public health to take a stand, to say this is our requirements, our ethical obligations to patients, to provide counseling information, and to really advocate against these laws so that we can do the right thing for patients.
Dr. Steinauer has been working to create a community across state lines that is focused on providing abortion care training to benefit as many patients and OB/GYN residents as possible.
We've been having meetings in our communities in restrictive states and in not restrictive states as well. We have a network of about 107 OB/GYN departments that we've supported to integrate training. And so it gives us this incredible opportunity to have regular meetings, to support each other across state lines, across regional lines, and to figure out how we can do the right thing for patients and our learners.
Physicians are also exploring telemedicine as an option for providing out-of-state abortion care. However, it might hold some complications.
We're also thinking of things like clinical care access right on the borders of states. So could someone just cross the border to a state with no restrictions or fewer restrictions and then receive even telemedicine abortion there? From someone within the state, so they don't have to travel all the way to an urban center or to a physical clinic. One of the tricky things is that you're required to have a medical license in the state where you provide telemedicine, and it's expected that the patient is in your state when you're providing it. And I think that's going to be tricky legally, but I do think it's a possible solution if we could figure that out.
Dr. Steinauer said another consideration is safeguarding patient privacy, especially in the uncertain legal landscape that overturning Roe has created.
So it's not just about clinical care. It's about systems of how to protect patient confidentiality, how to make sure that people's private information is confidential, that we're honoring HIPAA requirements, that we're not criminalizing people who come in. Many people have said this, and I agree that the risks of patients accessing medical abortion care outside of a clinical care system are not health risks, but they are risks that they will be criminalized and reported to law enforcement. And so we're really, we're trying to support programs to make that a priority in how they train their learners, but really how they work with all their hospital leadership to set up ethical policies around how to protect patients' care.